We've been talking about coronavirus for months now, and as Florida continues to reopen, people are having to decide what they feel comfortable doing and where they feel comfortable going.
For many, that includes going to the doctor's office or having procedures done.
So what's what when talking about urgent versus elective procedures? Morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Well, this is a question I have heard from many of you, so I wanted to make sure we addressed it. Doctors are still wanting to make sure people are getting the care they need despite the ongoing coronavirus pandemic. Now, they understand that there are concerns about the safety of their facilities, but putting off important procedures because of COVID fears can be just as detrimental to your health as getting the virus. So I spoke to Dr. Abhinav Goyal from Atlanta's Emory University Hospital over Zoom recently, and he breaks down the 4 categories of hospital procedures. Emergent and urgent are the 2 first categories.
If you call 911 and the paramedics come and they see on an EKG or an ECG that you have signs of an acute heart attack, that's an emergent procedure and you shouldn't hesitate. You come to the ER and we need to open up that artery. Our guideline is to open it up within 90 minutes of the paramedics getting to you. That's emergent. For those first 2 categories, the emergent and urgent, where you have symptoms and something needs to occur, it shouldn't even be a thought in your mind. You seek care like you would prior to COVID. You call 911 or you seek urgent attention and you get done what you need to have done.
Okay, now next we talked about elective procedures, which I know a lot of people have been hearing about, and they were suspended at many facilities during the height of the closures, but have since restarted at most places.
You have some procedures that are deemed elective, like if you have a bad knee or a bad hip and you need to have a hip replacement or a knee replacement. Well, those can be deferred up to a point, but then at the same time, your quality of life is suffering because you're not having those procedures. Those, for your quality of life, we're at a point where you can discuss with your care team, when can I have those safely done? You can feel assured that if your care team says this is a good time to have them done, you can have them done.
Then the 4th is the preventative category, which includes things like colonoscopies, cancer screenings, and mammograms, also those annual checkups.
Again, that would require you to have a conversation with your healthcare team. I'm due for my annual checkup or my routine colonoscopy, mammogram, whatever it is. Do you recommend I have it done at this time? And in many cases, we will schedule it so that it can be done safely as well.
One thing you really should not put off are those appointments that are for vaccinations. We've talked about that a lot, and you can get more information on those pediatric visits for vaccinations on clickorlando.com. As always, though, if you have any concerns, call your physicians, ask about the safety protocols, and make sure that you're taking care of yourself.